So what are the four parts of Medicare? The first part of Medicare is Part A. This is hospitalization coverage. It covers inpatient care, hospice, and skilled nursing. You've also got Part B of Medicare. B as in boy. This covers doctor visits, outpatient care, and preventative medicine. Then you have Medicare Part C. These are what are often referred to as those all-in-one plans. They package Medicare Part A, Medicare Part B, and usually Part D, standalone drug coverage. It packages it all together now, and it's administered through a private insurance company. Then you have Medicare Part D. This is a standalone prescription drug plan. These are often paired with a Medicare supplement policy, which we'll get to in a separate video. Then we need to understand, what does Medicare actually cost? Is it free, or do I have to pay for it? Well, you've been paying FICA tax all these years you've been working, and as long as you've worked at least 39 and a half quarters, you and your spouse are going to get Part A at $0 per month. But Part B, you're still going to have to pay for. The base monthly premium in 2025 is $185.50 per month. It can go higher than that based on your income, but it could also be zero if you qualify for state subsidies. Now, Part C of Medicare, that's going to vary based on plan availability, what county you live in, as well as what's available. Some plans may be as low as zero premium, but there's ones that could be into the hundreds of dollars per month. It just depends on what's available. Part D of Medicare prescription drug plans will have a varying premium as well. We've seen them as low as $0 a month, all the way up to well over $100 a month. It just depends on where you live. Now, what does it cover? What is Medicare Part A, B? What does it actually cover? Do you have any cost exposure? The answer is yes, you do have cost exposure. Part A has a deductible in 2025 of $1,676 per benefit period. It's important we understand that this benefit period lasts 60 days. So if you go in the hospital for one day, you're going to owe $1,676. Let's pretend you get discharged day 2 and you're free and clear in the hospital for 60 days, but you end up going in again 61 days later. You're now in a new benefit period and you're going to pay that deductible all over again. Part B of Medicare is a small annual deductible. It's only $257 in 2025. And once you've met that, Medicare steps in, they pay 80%, and you're left with the 20%. So these are things you should consider when you're enrolling in a Medicare plan or considering enrolling in a Medicare plan. You need to have Medicare Part A and Part B in order to enroll in a Medicare Part C Advantage plan. Again, remember, Part C combines A and B together, so you have to have both parts to package them together through a private insurer. And then you've got Medicare Part D. You need to have either Part A or either Part B to qualify to enroll in a Medicare Part D prescription drug plan.